Hello everyone and welcome to Blood and Hematology YouTube channel. In this video, the diagnostic criteria and blood and bone marrow morphology of hypergranular and microgranular variants of acute promyelocytic leukemia are discussed. Acute promyelocytic leukemia, APL, comprises 5 to 10% of AML cases and occurs in all age groups but is seen most commonly in young adults. APL is characterized by a differentiation block at the promyelocytic stage and is associated with a specific cytogenetic abnormality, chromosomal translocation 1517. In APL there is abnormal coagulation, disseminated intravascular coagulation and activation of fibrinolysis, resulting in abnormal bleeding and bruising. Chromosomal translocation 1517 is sufficient for diagnosis as AML with recurrent genetic abnormalities, regardless of blast and promyelocyte count. APL leukemic cells are strongly positive for myeloperoxidase or Sudan black B. They express CD33, but are negative for CD34 and HLA-DR. CD13 expression is variable. There are two common morphologic variants of AML M3. Hypergranular or typical, and microgranular or hypergranular variant. Hypergranular variant accounts for 60 to 70% of APL cases and usually presents with a low white blood cell count but with a dense marrow infiltrate. More than 30% of the blasts are myeloblasts and promyelocytes, and the predominant cell is an abnormal hypergranular promyelocyte. Microgranular variant accounts for 30 to 40% of APL cases. The leukocyte count in M3V is usually higher than in typical APL. Microgranular variant is characterized by a cell with a reniform or bilobed nucleus and apparently a granular cytoplasm. In hypergranular promyelocyte, the cytoplasm is densely packed with numerous bright pink or red to purple granules, which can obscure the nucleus. The nuclear shape can be folded, kidney bean-shaped or bilobed with only a narrow bridge between the two lobes. Nucleus has a diffuse chromatin pattern and one or more nucleoli. Hypergranular promyelocytes with different nuclear shapes in peripheral blood of a patient with typical APL. In hypergranular promyelocyte, single or multiple OR rods and OR rod bundles are often present. Leukemic promyelocyte containing bundles of OR rods in the cytoplasm is often referred to as faggot cell, a term derived from an analogy to bundles of wood sticks. In hypergranular APL, white blood cell count may be low or only slightly elevated. In peripheral blood, blasts and abnormal promyelocytes are present, and most promyelocytes have heavy granulation. Giant granules, single or multiple OR rods, and OR rod bundles are common. Schistocytes or fragmented erythrocytes also may be present. Peripheral blood smear of a patient with AML M3 showing blasts, hypergranular promyelocytes and a blast containing an OR rod. Peripheral blood smears of a patient with AML M3 showing faggot cells. The bone marrow is hypercellular, and leukemic promyelocytes account for about 30% of the myeloid cells in the classic variant. In the majority of cases, blasts are fewer than 30% of bone marrow nucleated cells. Or rods and faggot cells are often present. The distinctive cytological features are sufficient to permit a diagnosis, and cases are classified as AML-M3 despite the low blast percentage. Bone marrow film of a patient with hypergranular APL, showing blasts, promyelocytes, and/or rods. Bone marrow film of a patient with hypergranular APL, showing a faggot cell. Most cases of APL microgranular variant are characterized by an abnormal promyelocyte with a reniform, bilobed, multilobed, or convoluted nucleus and either sparse fine granules or apparently a granular cytoplasm. The nucleus has a fine chromatin and variably prominent nucleoli. Peripheral blood films showing characteristic bilobed nuclei in microgranular variant, resembling an hourglass, a dumbbell, or a mushroom. In microgranular variant, a variable proportion of leukemic cells may have or rod, fine dust-like granules, or cytoplasmic inclusions with the same staining characteristics as primary granules. White blood cell count in microgranular variant is markedly elevated and abnormal promyelocytes with deeply notched nuclei are present. Cytoplasm of abnormal promyelocytes may appear granular because of small size of granules. In some cases, hypergranular promyelocytes and/or rods may be totally absent. Peripheral blood smears of a patient with APL microgranular variant showing hypergranular promyelocytes with characteristic nuclear shape. In microgranular variant, bone marrow smears usually present a granular promyelocytes with deeply notched nuclei. Typical hypergranular promyelocytes constitute a small minority of the leukemic cells in the peripheral blood of patients with M3V, but they are usually more numerous in the bone marrow. In a minority of cases of microgranular variant, the characteristic cell is a small, abnormal promyelocyte with lobulated nucleus but with hyperbasophilic cytoplasm. Cytoplasmic projections also are sometimes present, so that cells may resemble megakaryoplasts. Hyperbasophilic promyelocytes are seen in the majority of cases of M3V AML, but usually as a minor population. Microgranular promyelocytes also can be confused morphologically with monocyte precursors. The diagnosis can be confirmed by cytogenetic, molecular genetic, or immunophenotypic analysis. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.